Hi, very good evening and greetings of the day. Today I have come up with a topic that is ICU acquired muscle weakness. Now, what is an ICU acquired muscle weakness? When a patient is being admitted in an ICU, the patients are being subjected for physiotherapy by a consultant physician or a doctor who is responsible for the patient. Now, when they are prescribing limb physio, it is the duty of a physiotherapist to identify what is the level of weakness the patient is having. So, this identification is being given by Medical Research Council some score. How do you identify that a particular patient is having acquired muscle weakness? So, this can be identified by MRCSS scores. Now, how do you do that? It is a 6 point scale which was developed in the year 1991, and a modified version was developed in the year 2012. Now, what do you do to measure this scale is you need to assess six groups of muscles: upper limb and lower limb. So, six groups includes the shoulder abductors, elbow flexors, wrist extensors, hip flexors, knee extensors, and ankle dorsiflexors. The total score of a 6 point scale is 5. The scoring starts from 0 to 5. So the total score is 5. So 5 into 6 groups of muscle. So total score is 30. So 30 on the right side, 30 on the left side. So total you have to add this 30. So you will get 60 as a total score. Now, this 60 is an indicative uh, number which indicates that the maximum power the patient has, and 0 indicates paralysis. So, or no contraction in the muscle. So, this is similar to that of the MRC grading: 0 to 0, there is no contraction, to 5 maximum movement with maximum resistance. So, that is the scoring as MRC it is been given. Now, what we do is we do these testing in two methods. Two methods you can do. One is isometric testing, other one is range of motion testing. So, you have to identify how well the patient is responding to you, and then you have to start doing this testing in order to find out whether the patient has developed ICU acquired muscle weakness. Now, if a score is less than 48 out of 60, the patient has developed ICU acquired weakness. If the score is less than 36, okay, it is indicating that the patient has developed severe ICU acquired weakness. So, it is the duty of a physio to see to that the patient does not reach to that level. That is, the movements has to be maintained and exercise sessions should be monitored. So the exercise session should be given in such a way that the rest period has to be included between the sets, and breaking down the sets into several components is an important factor, because fatigue can set in and thereby the muscle function can deteriorate. So it is very important that assessing a patient by MRC SS score to check whether the ICU acquired muscle weakness has been developed. And physiotherapist doing this will help in regaining the function very well by the patient, and easy discharge and developing a functional pattern is easy for these patients. Thank you. This is Sumi Rose, Brain and Physiotherapy.